Hi Mama. So when you have your baby, you can very easily be deficient in iron. In fact, many mothers are already deficient before or during pregnancy. And it's quite common, once we've had our baby, because in those early weeks of postpartum, we can lose quite a bit of blood. So I just want to share with you today that this can be corrected through whole foods and herbs. Some signs of iron deficiency can be things like feeling tired more easily. I know we already have that tiredness happening from a baby, but there's dizziness, could be headaches, shortness of breath, trouble concentrating, looking a bit pale, and it also affects digestive function. But a big issue can also be postpartum depression. And iron levels are often overlooked with doctors or healthcare professionals, and often antidepressants are prescribed. But if your doctor or healthcare provider does actually prescribe a supplement, the one that they usually prescribe often makes women feel a bit sick, and it's harder for them to digest. It affects the digestive system, and it's not ideal at this time, when you need that extra support with your digestive system. So receiving iron with herbs and whole foods is really a great way for women to build up their stores. Of course, always check with your healthcare provider, preferably one that knows about the wisdom of herbs. So some of the common herbs that are beneficial after birth and can be consumed as a tea are things like alfalfa. You've got dandelion roots and leaves. You've got burdock root. There's nettles, yellow dock, parsley, raspberry leaf, and also remember to include something like rose hips, which is high in vitamin C, which helps to absorb the iron. If you're getting iron from foods, some vegetarian sources is blackstrap molasses, spinach and kale, quinoa, pumpkin seeds, quality dark chocolate, and dried raisins, prunes, lentils, and also chickpeas. But it's best to avoid those legumes, in the early few weeks of postpartum, because they can cause gas in you and also colic pain in your baby. Of course, if that doesn't bother you and your baby, then you can eat them. Meat sources are grass-fed beef and livers, and chicken livers, organic chicken livers as well. It's not the entire list of foods, just a general guide. But just remember, you need a source of vitamin C with these iron-rich foods to help absorb. Nasturtium leaves are actually quite rich in vitamin C, and they can be a really good option if you don't mind that mild mustardy zing that some leaves have. And it's best not to eat too much raw greens. In fact, keep them quite limited when you've just had your baby. So getting iron from your foods, whole foods, is great. But if you need a supplement, try and get a liquid-based one that's based on plants. So Floridix is a brand that you can get from most health food stores. But overall, listen to your body, and you know if you're not feeling right. So get some blood tests, although these can be a little bit unreliable. But if you get your blood tests done, ask for them to be printed out and take them to a naturopath or a herbalist and have them read the results, and they will most likely help you get what you need. So if you're looking for more assistance with meals for postpartum health and well-being, you can check out the postpartum nutrition program that I offer. It's called Mama's Nutrition and Wellbeing. It's a 6-week program, and it's catered for mothers up to several years postpartum, not just for early postpartum. And it helps bring balance to hormones, to your digestive system, which gives you energy and vitality, and it just helps with so many issues. And it can also help with depression and anxiety and autoimmune and thyroid issues as well. So check that out. And if you've got any questions, certainly reach out to me. I'm here for you, and I would love to see many more mums thriving after having their baby. Thanks for joining me today, and many blessings. Bye for now.